one of the factors that contributed to the cultural ubiquity of cyborgs, organisms with a cybernetic structure or component, in popular culture is the 1984 Terminator film series. We're closer to being called a cyborg than you might believe, despite the fact that you might picture cyborgs as futuristic beings with a robotic body and a combination of human and superhuman qualities. Let's have a look at these 6 fascinating technologies that potentially cyborgize humans. Like and subscribe to the channel to receive new content every day. 1. Pacemaker. Designed to prevent complications in humans with irregular heartbeats, the electronic pacemaker appeared in 1958 as a result of the work of physicians William Chardak and Andrew Gage, and engineer Wilson Greatbatch. The first electronic pacemaker was implanted in a human in 1960, allowing the person to live for 10 months without any complications being noticed. With the advancement of technology, pacemakers have improved exponentially and continue to be used by millions of human beings to the present day, to the point of being considered a common device. 2. Artificial heart. The world's first artificial heart is still in the testing phase, but it already shows that it can give more autonomy to people with severe cases of heart failure. Called Karma Total Artificial Heart, CTH, the device has a self-regulation mechanism adaptable to the patient's daily life. The use of the artificial heart would mean that fewer adjustments and trips to medical centers would be necessary. The FDA, the U.S. Health Regulatory Agency, approved its use in February 2021. Since then, it has been possible to make use of the artificial heart as a palliative technology, that is, used while awaiting traditional heart transplantation. 3. Robotic exoskeleton. Robotic exoskeletons are already a reality. Its use, both as a medical device and for the final consumer, has already been approved by the FDA. While presentations may vary, robotic exoskeletons are generally wearable braces designed to help patients achieve greater mobility, providing pain relief. In Brazil, a group of researchers from the University of São Paulo, USP, developed a robotic exoskeleton with the aim of helping health professionals in the treatment of victims of stroke. It helps to treat multiple leg joints simultaneously, such as ankle, knee, and hip. 4. SmartBone, the smart bone. In 2012, IBI, a Swiss biotechnology company, launched the SmartBone, designed to be used as a substitute for organic human bone. SmartBone was created by combining a bovine mineral bone matrix with bioabsorbable polymers and collagen fragments. According to the company, the SmartBone mimics all the characteristics of a healthy human bone, including high mechanical performance. It's not adamantium, and no one is going to become Wolverine, but the consensus is that it's a huge step forward in terms of medical procedures. 5. BrainGate, the technological brain. Another technology developed to help humans, BrainGate is a brain implant system created by neuroscientists and researchers at Brown University in Providence, United States. Through the use of electrodes implanted in a patient's brain, this technology restores some muscle function in individuals who have lost control of their limbs or other bodily functions, such as amyotrophic lateral sclerosis (ALS) patients or who have had a spinal cord injury. Since its inception, it has changed the lives of many patients who are now able to feed themselves, for example. This technology continues to be developed so that it may one day be available to all patients. And no one is going to have a brain capable of reading minds. 6. Bionic eyes. Okay, probably bionic vision through a robotic eye is one of the first things you think of when we talk about cyborgs. Now, science has developed bionic eyes whose progress has helped many people to have functional vision. Second Sight, an American company, developed one of them, called Argus 2. It is the combination of a miniature eye implant with a camera and a processor, which transform the way the patient sees the world. Using a kind of glasses, the camera mounted there receives the information, which is converted into electrical pulses and transmitted to the retina. The eye implant then stimulates the patient's retina, sending the information to the user's brain, which can simulate vision. It's an initial step so that people who have lost their sight can see. Again, there's just no possibility of X-ray vision. Nobody here is going to become an X-Men. Tell me what you think in the comments below. Like and subscribe to the channel, and check out the suggested video. I'm pretty sure you'll find something interesting and valuable.